All right, welcome everyone to episode 12 of How to Become a Doctor. So, if you haven't watched the other episodes, you can go back and see those on our YouTube channel. But if you're a pre-dental student, then this is your time. It's our first one, specifically geared towards pre-dental. Our first 5-6 podcasts, we did an overview for all pre-health students. Then I've recently started doing interviews, so have some other great interviews coming up. But this week we do have Dr. Brooks Hummel with us, who's an orthodontist, and he not too long ago, I was walking on campus here as a pre-dental student, and stayed close to home. Went to LSU Dental School, but we're going to hear from him. I just want Brooks, you to introduce yourself and just share, where you're at right now, where you practice, that sort of thing.
Absolutely. I'm Brooks Hummel, as he mentioned. I'm an orthodontist here in Baton Rouge. I finished up my residency a year ago, and I joined the existing practice of Hiller Orthodontist, joining Dr. Mike Hiller. He's been practicing in Baton Rouge for 32 years now. So I've got the privilege and honor to work alongside with someone with a lot of experience. He was actually one of my part-time faculty members down at LSU. So it really was just a match made in heaven, being able to come back here. Fell in love with Baton Rouge whenever I came to school here, and I'm excited to be back here and start thinking down my roots back in this community.
Yeah, no, that's awesome to have that kind of that full circle and be back in town, and exciting too to have be a little bit past some of the COVID shutdown stuff and be able to enjoy Baton Rouge a little more. So we do just want to hear a little bit of your story, and kind of starting at the beginning. Our first question for you is, how did you decide to get in? How did you become interested in dentistry and orthodontics? What was it that led you towards the profession?
Yeah, so for me, it was close to home. My dad's an orthodontist. He actually just retired after, I guess, 37 years of practice. He just retired from his private practice in Monroe, Louisiana, which is where I was born and raised. And there was always kind of an idea that was in the back of my head. Well, Dad seems to really enjoy what he does, where you have, big family values, and he was able to be there for all my ball games and take care of our family and, give us opportunities that I thought were, great. And I wanted to be able to do the same for my own family. So, dentistry was always on my radar. Whenever I got into high school, found that I was pretty good at, the sciences and really wanted to do something in healthcare. So I explored a bunch of different fields. We had family friends who were physical therapists. I went through physical therapy myself. I thought, man, that's exactly what I want to do. And then I also explored, internal medicine. I went and shadowed physicians, but everything always just kind of kept coming back to dentistry. And for me, it was just a good blend of, knowledge and learning, but also working with my hands. I'm by no means a carpenter or some kind of master artist, but I do like working with my hands. And so it was a nice little blend of that. The other thing about dentistry that was very appealing to me was the ability to be my own boss. And I think with healthcare, a lot of people in medicine would tell you that, they kind of miss having some of that autonomy. And it's still out there for certain medical fields and specialties. But to have my own practice where I can, make some decisions, don't have to worry about, going through red tape to, treat my patients. That was very appealing for me to have that autonomy, to work with my hands. And ultimately, it's about the patient. So I'm getting to build those relationships with people to establish that and try to be, someone in the community that takes care of people and has a reputation. Those are things that are important to me.
Great. No, that's helpful. If you did just kind of walk through, you did explore other things in the healthcare field, and it's neat to kind of see, you gave everything a good thought, and even went out there and shadowed, and that's a great thing to get in the field to really see what you want to do. So obviously you did land on dentistry, and we're going to get more into your residency such later, but obviously you were at LSU. You were a pre-dental student at one point. You dealt with the time management stuff and the stress of applications and the dad and not knowing if you'll get in. So why don't you just dip back a couple of years ago, think about what were some significant things about your pre-dental journey as an undergrad that you want to share or talk about?
Yeah, so first and foremost, these two gentlemen here, Mr. Matt Durst, Mr. Robbie Bowen, are are phenomenal resources. So please, use them. They've been doing this for a while. I know Mr. Durst joined recently because he and I were in undergrad together, and we go back a few years ourselves. But they're a great resource.
I'm old, so.
And then also, the Pre-Dental Society is fantastic. I got a little started late. I don't think I really joined until my sophomore year, and that's one of my regrets. I wish I would have gotten a little bit more involved, maybe try to be an officer or something like that. So definitely would encourage you to get involved with Pre-Dental Society, and then get involved elsewhere, and other clubs, organizations on campus, with a church or something like that. There's going to be good volunteer opportunities with that. And that's one of the big things that they look for on a dental school application. And then obviously, working hard, keeping that GPA up. You got to pick those classes where, they may challenge you a little bit, but stay on top of your work and do well. And a lot of times that's something that carries a ton of weight as well. And then also I would encourage those who are starting to get into your upper level bios, start finding out what the curriculum is in dental school and med school. Because if you are taking, the histologies, some of the anatomies, to cell bio, things like that, which I think is a prereq now, that looks great on your resume to be able to see some of those classes, which are a little bit more challenging. And, they are kind of elective in nature because you just have to get certain upper level bios, really challenge yourself, try to balance your plate with your, other courses. I'd certainly encourage that. Don't go swimming in 4 upper level bios in one semester unless you enjoy, being miserable. But yeah, it's just doing those little things right. And then certainly the other thing is being in touch with Dr. Sheremy. Dr. Sheremy is one of the greatest people on the face of this planet. He's the Dean of Admissions at LSU. If you haven't met him, haven't heard him talk, make sure that you make every effort to meet him, introduce yourself, because he is your number one cheerleader. And he loves doing what he does. And then the last thing would be, whenever it does come time to apply early, get that application in, do all the right things, because it's really easy to disqualify yourself if you don't stay on top of things organization wise. But yeah, those are all the little things to be able to take care of.
That's really helpful, and obviously you said some great things there. I especially want to highlight what Brooks mentioned, just about looking at your coursework you will be taking, because people always think about, how do I get in? But as he's saying, it's not just about getting in, but preparing yourself. So, well, great. So, obviously, you went down to New Orleans, went to dental school there. Why don't you share a little bit about just dental school, those 4 years that maybe a lot of students aren't aware of what that's like,
Yeah, I think one of the things, if you don't know anyone who's in dental school or, who's gone through it, the camaraderie is second to none. One of the things I love about our dental school is, so for me, we graduated with about 60 students, and I knew everybody. I knew who their significant others were. I knew who their kids were. I could tell you about some of their family life, where they grew up, things like that. So it's one big family, and I really think they do a good job of fostering that. We have these things called GIFs, which is short for TGIF, and it's a little social that we hold on Fridays at the dental school, and you can go and eat and drink with your classmates, your faculty, your classmates' kids, and it was a really fun thing that we would do. And unfortunately, COVID kind of nixed that for a little bit, but I think they just started bringing them back. And yeah, I mean, as far as your faculty are there to help you, not to hurt you. I know in the past, especially whenever my dad was going through dental school, I have an older sister who graduated 8 years ahead of me. I remember them talking about how intimidating some of the faculty were and how they kind of loomed over you and put the fear of God in you. But my experience was very different. They were challenging, and, there's a professional etiquette that you have to uphold. But at the end of the day, I got to know them well. They respect you as colleagues, because that's what you will become. Once you graduate, you're going to be one of their peers. And so there's a lot of mutual respect between the faculty and the students, and vice versa.
Awesome. That's great to hear. I mean, because obviously there's a lot of fear there. And of course, because, getting in, but once you're there, it sounds like, great community to be part of. And, obviously you took a little different route. I'm sure, a lot of your classmates didn't do a residency. So, we really want to hear, especially from you, about your going back into your mind. Like, how did you, think about deciding to do a residency? When did you decide these things? What are some things maybe a future student would think through if they're maybe going to pursue a residency? So why don't you share about that?
Sure. Yeah. So, again, my dad was an orthodontist, but my sister, who's 8 years ahead of me, she's a general dentist, and she got into school thinking, I'm going to go and become an orthodontist, go take over dad's practice. But she looked at dad one day, like, Dad, I love you. I hate orthodontics. And so she decided to stick with general dentistry. And when she made that decision, and I was already contemplating dental school, I thought, man, I should keep my options open. I really should, because maybe I'll like something else. There's a lot of different specialties, and there's even more that are being added to the list. And that kind of openness was good, but at the same time, I knew that to become a specialist, you do have to do certain things like be involved in dental school organizations, keep your GPA up, do volunteer work, things of that nature. So I kind of had that in mind of, I'm going to work as hard as I need to specialize, so that if I decide to specialize, I'm going to be able to be in a position to apply and be competitive. I didn't want to disqualify myself because I wasn't 100% certain or not. So those first 2 years, whenever you're kind of doing all your general dental stuff, you're just learning what teeth look like. You're learning how to wax up teeth, to do fillings and things of that nature. I was really just trying to imagine, okay, what is my life going to be like if I were a general dentist? Is this what I want to do? But also seek out excellence so that I could, perform well enough to be able to pursue a specialty. So around between second and third year, I was starting to, think, okay, I do think I like orthodontics. At that point, you've had some basic introductions to all the specialties. You have a periodontics class, you have an endodontics class and lab. You had oral surgery courses and things like that. And the orthodontics class, was interesting to me. I like the idea of, working with, my patients to come up with a treatment plan that meets their goals, whether they're realistic or not, and try to deliver the best results through good diagnosis and treatment planning. I like that kind of puzzle work. And so then I said, well, I'm not going to go and shadow my dad's practice. I've been in that practice a million times. I need to go try something else. So I went and shadowed a few different orthodontists. Some were down in the New Orleans area. Then I went and shadowed over in Gulfport and over here in Baton Rouge. And after, seeing these different practice models, they were small, they were big, saw a ton of patients, saw a few patients, and seeing how, it's all the same field, but you have so many different ways to do it. I was like, yes, I think I do want to do this. This seems, like exactly kind of what my goals are for my life and what I want to get out of my career. And so at that point, you're going into third year, and that's when you kind of start doing all the legwork of getting your application ready. And you start showing up to the orthodontic seminars to make your face known and try to meet the faculty so that you can make a favorable impression with them. And then after third year is whenever you actually have the application process, which is as stressful as the dental school process. So it's fun to relive all that.
That's so you've been to the ringer twice. So I guess it's good. It's good you're done now. But yeah, that's a lot of anxiety to take on. But that's helpful, as you kind of just give that timeline a little bit, because in one sense, it seems so far away for some of these students that, that's going to be not until I get in. But at the same time, like you mentioned, even in dental school, keeping your grades up, being involved, doing service early on is going to pay off for sure. So yeah, that's helpful there. That's kind of a little bit of your story there. I just want to hear a little more about that bridge, right? So, you dental school, residency, and then we might hear about residency in a little while, but why don't you share a little bit about, from residency to the workforce, what that transition looked like?
Yeah. I mean, for me, it was, all the situations are unique. I was given the opportunity to buy into the practice. So there's a little bit of, component that they don't teach you in dental school of what a transition looks like, how you go about getting financing and stuff like that. And so for me, my first month in the practice, we were kind of finalizing all the details, but I was still seeing patients. And so instead of just throwing me into the deep end, say, here, go treat all these patients, I got to see a few patients a day, and I was working really closely with Dr. Hiller and trying to learn his systems, his treatment plans, his philosophy. And, luckily I'd worked with him in residency, so I kind of knew most of those things. And for our residency, we're a very clinical based program. And so I felt like it was pretty seamless going from, residency to private practice. The main difference being in residency, as a resident, you do all the work. So, if any of you have had orthodontics, you're probably like, my orthodontist doesn't do anything. It's the assistants. They do all the work. And there's a little bit of truth in that. They do a lot of work for us, and we certainly couldn't do what we do without them. But, being able to come in and you sit down and you have to re-diagnose and treatment plan from where this patient is at that point, and then dictating to your assistants what to do. So it's funny, I would see about 5 or 6 patients, maybe in a morning session or an afternoon session. And all of a sudden I went to see, and, there's 50, 60, 70 patients in one day. So it was a big jump, but I felt like I was prepared for it. And, definitely feel like I've been able to get settled in here.
Awesome. Yeah, that's some good clarification for sure. And, we know you guys put your work in, but sometimes it's not always seen, So, okay, well, Robbie, we do have a few questions that came in, right? You want to hit some of those?
We do have a couple of questions, but before, where did you do your residency for orthodontics?
I did my residency at LSU in New Orleans.
Okay, so you had both experiences for the dental school and the residency in the same location. But can you talk a little bit about what's different about it, the 4 years of dental school and then the residency? I mean, I know 4 years you're in class, you're going to clinic. In the residency, what are you doing most of your day?
Yeah, so for us, like I said, we're a very clinical based program. So we're in clinic, and that was our big thing. That's kind of our hard sell whenever we have people coming in who are interviewing from other schools, is you're going to see patients. You're going to work hard. You're going to learn by working side by side with established private practice doctors. We had 2 full-time members of faculty, and then we had about, there's probably about 14, 15 part-time faculty members who come, and they have specific days of the week or days of the month that they come in and treat patients with you. So there's a lot of side-by-side learning, and then kind of our bread and butter is a seminar. So in dental school, you have tons of lectures. You'll have different labs where you're learning how to do procedures, whether it's, prepping for crowns, whether it's for, morphology, things like that. Well, you can forget about all that once you get into your specialty, because I didn't have to do any of those other things. I could focus strictly on orthodontics. So all my patients are orthodontic patients. I'm doing braces or some type of aligner therapy. So for me, it's whittling down what procedures I'm actually doing on my patients. And then as far as the class, setting, we still have classes that you take with some of the other residencies. So perio, oral surgery, endo, prosthodontist, and there's any others that I'm not mentioning right now. And we still have some didactic work where we're all kind of learning stuff, whether it's head and neck anatomy. We had, pain and TMD type stuff. And then you have your more specialized classes. So for us, it's wire bending, learning how to move teeth. And then we have a seminar, which is the staple of our program, where every single day we go through a case, diagnose, treatment plan, and walk through, see the progress, and answer questions that our faculty kind of throw at us. So, the learning is in a smaller setting, which is really nice. I had 4 co-residents in my year, and then you have 4 co-residents, whether a year ahead of you or a year behind you. So it's nice being able to work in that setting. And for us, it's a very laid back program. So there was no intimidation there. There was a ton of respect. The faculty call you, Dr. Hummel, or, whatever you're like, Dr. So-and-so. And even just that mutual respect that you have, it carries so much weight after you've been just grinding it out for 4 years of dental school.
Okay, so we do have a couple of questions from our students. One says, I think you mentioned this, but when is the best time to shadow? I think you said it was freshman and sophomore. Is this when you did it? But I want to make sure.
Yeah. I'd tell you whenever you have time. One thing that I felt like I took for granted in undergrad was realizing how much time you have on your hands. And I know it doesn't feel that way whenever you've got projects and papers and tests kind of constantly coming at you, but just do a little bit at a time if you've got a break or an afternoon off, or fall break or spring break, things like that. Those are good times to do it, so you don't have the stress of class and balancing that out. Or if you have a day where you just have nothing in the afternoon, just go knock out a few hours at a time. And definitely diversify, where you go. Don't go to just like for instance, if you have a family dentist or a family orthodontist that, you've known for years, go check out their practices, but really go and try other things. Go see a bunch of different models. And when you're there, ask them, hey, do you have any colleagues that I could go and shadow? That way you can kind of see a bunch of different, practice settings and see what you kind of like or not. And then those are, I wouldn't necessarily say take notes, but take mental notes, certainly, because if you do get an interview, they'll ask you, what was something that stood out to you whenever you were shadowing? And I remember that was a question I had in my interview for dental school. And I was able to give them, one special memory I had of a patient and provider interaction that I thought really stood out to me and was significant. And I felt like it was one of those things where I said, this is something that I'll take whenever I go and practice too. So yeah, whenever you have time, just go and do a little bit at a time.
Okay, and the next question is about the dreaded DAT. What's the best time to take the DAT and applying for dental school?
Yeah, I mean, I think that really depends on your schedule and what's going on in your life. I took it, let's see, it would have been winter break, like January after winter break for my junior year. So at that point, I had already taken my organic chemistries. I'd taken, I think, one upper level bio, maybe biochem or something like that. So I felt like I had a good base from just learning based on my coursework. And then it was also nice because I could do it at my own pace over, the winter break without having to worry about juggling other tests and stuff like that. And if I felt like my DAT score wasn't to what I wanted it to be, I still had time. I think, is it a 90-day waiting period?
Yes.
Yeah. Okay. So I felt like, okay, if I take it in January, it's not what I want. Well, I could still maybe try and take it at the end of May and have a little bit of time after finals to kind of revamp and reassess what areas I maybe needed to strengthen, and take it right there before, the timeline for applying, which I know the applications open up, early May now?
Yes. 1st of June is when ad says you can start submitting, but it'll usually go live in May. Yeah. Okay.
Yeah. So we didn't have access until June 1st. So I thought, okay, if I take it at the end of May, I've got my score, and then I can apply and get everything in, early June, something like that. So I'd say it really just depends on what's going on. But if you've got, you got to take a winter session course, that may not work for you. If you have, a huge family trip and you don't want that to cut into it, then maybe that doesn't work for you either. But certainly somewhere after second year, get those organic chemistries down, I'd say. But like I said, I felt like I benefited from having a couple more upper level bios to draw upon. So I didn't have to, study that material as much. I could focus on other areas that I felt were a little bit more deficient.
Yeah, so we recommend spring of the junior year. So that's in line with what we normally do. And there is a 90-day waiting period. So that does give you a couple shots before the deadlines to apply. And so hopefully you score what you need on the first test. But if not, you do have a safety net of a window of time that you can take it again. So if you have other questions, you can unmute yourself, or you can put it in the chat box.
Hello, I have a question. Can y'all hear me?
Yes.
I have headphones up. Okay, so yeah, one of my questions was, you said you did residency in like really different places like New Orleans, and then I forgot the other places. How did you like balance your life, like going to different places during residency?
So for us, all our dental school was in New Orleans, and then you do random rotations at different places, but they were usually within a driving distance. Okay. And then for us, residency, we were all in New Orleans as well. It was in the same building as the dental school. We had our own clinic. But for us, one of the things we like to do is we would go and shadow some of our faculty members' practices. And that was usually for like a half a day. So we have faculty from all over the state. So we went over to Lafayette for a half a day. We came up to Baton Rouge and saw 2 different practices in the same day. And it's really in your second year, whenever you've kind of gotten the bulk of your coursework done. And now at that point, you're kind of finishing up patients and handing them off to the first years that are coming in behind you.
Oh, thank you.
You're welcome.
Anyone else have any questions?
I mean, if no one else has any questions, just one more question I think would be good to answer. Obviously, for you, you've been around dentistry with your dad and sister, being in the field, obviously you're pre-dental, you're in dental school residency, but I'm sure there was still one or two things that's different as now working, full time in the profession. What would you say that is? What's kind of surprised you of working in the profession now that maybe was different than you expected?
Ooh, that's a good one. Let's see. I think probably the biggest one for getting into it is honestly for us as an owner doctor, you're starting to learn all the other business things that you just never think about. So some of it's not even due into orthodontics. A lot of times that's the easy part of the job. The other stuff is, how do I motivate my patients and how do I work with them to, get them the best care that I can? How do I meet their expectations? Because there are, expectations for your orthodontist to get everything just perfect. And I'm certainly the kind of person, I'm hard on myself whenever I mess up and don't, get the best results. So I think there's a lot of grace that comes with learning how to manage your staff, to talk with your patients and how to, deliver good, compassionate care. Because, that's one of the things that we do. We're supposed to do right by our patients. And like I said, you can learn how to move teeth and have all the knowledge in the world, but if you don't know how to talk and have that interpersonal communication with patients, with other providers, other dentists, and things like that, then you may struggle with that aspect of your career.
That's great. Great insight there. And it looks like we have time for one last question, which just came up. So the last question was just about your experience at LSU. How many years was your undergrad and what was your major under pre-dental?
Yeah. So for me, I came in with a little bit of dual enrollment credit. And so I was able to finish up in 3.5 years. And then I worked in a dental office for about 7 months before starting dental school. I wanted to stick around Baton Rouge. So that kind of gave me an excuse to hang around and still be with my friends who were doing the 4-year track. And then I was a biological sciences major. So that's probably the bulk of you all. And I tell you that that's still tried and true. The majority of my, colleagues and my classmates in dental school were biological sciences major. But, I had some former engineers. I had a construction management guy who was in my dental school class. There's many roads to get to dental school. So there's certainly not that one size fits all major, but it's a good foundation. You're going to get all the courses that you need without really having to go out of your way to tack on extra classes if you do it that way. But I mean, if you like kinesiology and that's interesting to you, you want to knock that out. If you like chemistry, God bless your soul, not for me. But that's another good one that looks really impressive. And then, another one of my classmates, he was like an international studies major. So he was like lots of different languages and stuff like that. So like I said, there's a lot of different ways to do it, but certainly, perform well in whatever biology courses that you do take, the sciences and obviously the rest of your classes. Don't, blow off your music appreciation class just because it's not, important because they look at everything pretty holistically.
Awesome. Well, thanks again. Really appreciate you joining us. And, obviously some of you guys are going to be watching this as a recording. Thank you to those who came out live. But we are going to end right here. We just want to say if you do have any more questions for Dr. Hummel, you can send those questions to Mr. Bowen or I, and we can pass those on to him via email and get it back to you. So thanks again for joining us today, everybody, and definitely join us for the next one.
It was a pleasure. Thanks for having me, and good luck to all of you who are applying. And I can't wait to call you all colleagues.